Good evening, everyone. BSAയുടെ ആഭിമുഖ്യത്തിൽ നടത്തുന്ന ഹെൽത്തി ലിവിംഗ് പ്രഭാഷണ പരമ്പരയിൽ ഇന്ന് നമ്മൾ ചർച്ച ചെയ്യുന്ന വിഷയം നമ്മുടെ ദിവസത്തിലെ ഏറ്റവും ലളിതമെന്ന് തോന്നുന്ന എന്നാൽ ജീവിതത്തിലെ കാൽഭാഗവും നമുക്ക് നീക്കിവെക്കേണ്ടി വരുന്ന ജീവിതത്തിൽ ഒഴിവാക്കാൻ പറ്റാത്തതായ ഒരു അത്ഭുതകരമായ പ്രക്രിയയാണ് ഉറക്കം. അതേക്കുറിച്ചാണ് നമ്മൾ ഇന്ന് പ്രഭാഷണം നടത്തുന്നത്. എനിക്ക് തോന്നുന്നത് ഇന്നത്തെ കാലഘട്ടത്തിലെ ഈ വേഗതയുള്ള ജീവിതത്തിൽ ഏറ്റവും ഒടുവിലത്തെ സംഗതിയായി നമുക്ക് പ്രാധാന്യം കൊടുക്കുന്നത് ഉറക്കത്തിനാണ്. കഴിഞ്ഞ കുറച്ച് വർഷങ്ങളായി ലോകത്തിൽ വളരെ ട്രെൻഡിങ് ആയിട്ട് സംസാരിക്കുന്ന വിഷയമാണ് ആൻറ്റി ഏജിങ് അല്ലെങ്കിൽ ആൻറ്റി റിവേഴ്സൽ, ഏജ് റിവേഴ്സൽ, ലോഞ്ചിവിറ്റി എന്നീ വിഷയങ്ങളൊക്കെ. ഏറ്റവും മുൻനിര ലോഞ്ചിവിറ്റി വിദഗ്ധർ പറയുന്ന ഒരു വാചകമുണ്ട്: ഏജിങ് is not natural but a disease. If aging is a disease, then a good sleep is nature's own anti-aging therapy. ബില്യണർ ബ്രയൻ ജോൺസൺ ഒരുപാട് ബില്യൺസ് ചെലവാക്കി എങ്ങനെ ആക്കാതെ നോക്കാം എന്ന് ശ്രമിക്കുന്ന അദ്ദേഹം സ്ലീപ്പ് ഈസ് യുവർ ബോഡീസ് ഡെയിലി റീബൂട്ട് എന്നാണ് പറയുന്നത്. ഒരു രാത്രി നല്ല ഉറക്കം കിട്ടിയില്ലെങ്കിൽ എന്ത് സംഭവിക്കും? നമുക്ക് പലർക്കും അറിയാതെ അടുത്ത ദിവസം മൈൻഡ് സ്ലോ ആവും, ബോഡി ഹെവി ആവും, എനർജി ലോ ആവും, ഇൻഫ്ലമേറ്റഡ് ആവും, ഫോക്കസ് കിട്ടില്ല. നമ്മൾ എക്സസൈസ് ചെയ്യും, ഡയറ്റ് നോക്കും, സപ്ലിമെന്റ്സ് കഴിക്കും, പക്ഷെ ഉറക്കം ശരിയായില്ലെങ്കിൽ അവയുടെ ഫലം പകുതിയായി കുറയും. ഇത് നമ്മൾ പലരും ഓൾറെഡി എക്സ്പീരിയൻസ് ചെയ്യുന്ന വിഷയമാണ്. നമ്മൾ കേട്ടിട്ടുണ്ടാവും യു കനോട്ട് ഔട്ട് റൺ എ ബാഡ് ഡയറ്റ് വിത്ത് ഗുഡ് എക്സസൈസ് എന്ന്. പക്ഷെ ഇപ്പൊ എക്സ്പേർട്സ് പറയുന്നത് യു ആൾസോ കനോട്ട് ഔട്ട് റൺ bad sleep with good diet or good exercise, because sleep is not just a rest, it is repair, reset, recovery and rejuvenation. ഞാൻ കൂടുതൽ ദീർഘിപ്പിക്കുന്നില്ല. ഈ വിഷയത്തെക്കുറിച്ച് ആധികാരികമായി സംസാരിക്കാൻ ഇന്നിവിടെ നമ്മോടൊപ്പം ഉള്ളത് പ്രഗത്ഭനായ ന്യൂറോളജിസ്റ്റ് ഡോക്ടർ ജോയ് എം എ ആണ്. BSIയിൽ BSIയിൽ വളരെ കാലമായിട്ടുള്ള മെമ്പർ കൂടിയാണ് അദ്ദേഹം. ഞാൻ പഠിച്ച ഡോൺ ബോസ്കോ സ്കൂളിൽ എൻ്റെ 2 വർഷം സീനിയർ കൂടിയാണ് അദ്ദേഹം. എനിക്ക് അദ്ദേഹത്തിന്റെ പേര് കേൾക്കുമ്പോൾ തന്നെ ഓർമ്മ വരുന്നത് ഓരോ വർഷവും എല്ലാ പരീക്ഷയ്ക്കും സ്റ്റേജിൽ കയറി ഫസ്റ്റ് റാങ്ക് ഗോൾഡ് മെഡൽ വാങ്ങുന്നതാണ്. എൻ്റെ ഓർമ്മ ശരിയാണെങ്കിൽ ഒരിക്കൽ പോലും ടോപ്പ് റാങ്ക് മറ്റാർക്കും വിട്ടുകൊടുത്തിട്ടില്ല ഡോക്ടർ ജോയ്. ഇന്ന് ക്ലിനിക്കൽ ന്യൂറോളജി, മൂവ്മെന്റ് ഡിസോർഡർ, ബോട്ടോക്സ് ചികിത്സ, സ്ലീപ്പ് ന്യൂറോളജി എന്നിവയിൽ അദ്ദേഹം കേരളത്തിലെ തന്നെ ഏറ്റവും പ്രഗത്ഭരിൽ ഒരാളാണ്. അശ്വിനി ആശുപത്രിയിൽ ഹേമാസ് ക്ലിനിക്കിലും സീനിയർ കൺസൾട്ടന്റായി പ്രവർത്തിക്കുന്നു. അതിനു മുമ്പ് അപ്പോളോ അറ്റ്ലക്സ് ഹോസ്പിറ്റൽ ന്യൂറോ കൺസൾട്ടന്റായും അമൃത ഇൻസ്റ്റിറ്റ്യൂട്ട് ഓഫ് മെഡിക്കൽ സയൻസിൽ അധ്യാപകനായും വളരെ കാലം സേവനം അനുഷ്ഠിച്ചിട്ടുണ്ട്. യൂണിവേഴ്സിറ്റി ഓഫ് കാൽഗരിയിൽ ഫെലോഷിപ്പ് നേടിയിട്ടുള്ള അദ്ദേഹം 800-ൽ പരം ഡോക്ടർമാർ ഒരുമിപ്പിച്ച MD ഡേയ്സ് എന്ന മഹത്തായ അക്കാദമിക് കമ്മ്യൂണിറ്റിയുടെ സ്ഥാപക നേതാവ് കൂടിയാണ് അദ്ദേഹം. നമുക്ക് ഇന്ന് സമയം പരിമിതമാണെങ്കിലും നിങ്ങൾക്ക് അദ്ദേഹത്തോട് ഉറക്കത്തെ സംബന്ധിച്ചുള്ള സംശയങ്ങൾ എല്ലാം ഉൾപ്പെടുത്താൻ ഞങ്ങൾ പരമാവധി ശ്രമിക്കുന്നതാണ്. ഈ പ്രഭാഷണം കേൾക്കാൻ ഇവിടെ സന്നിഹിതരായിട്ടുള്ള എല്ലാവർക്കും വേണ്ടിയും ഭൗമത്തിനു വേണ്ടിയും ഇന്നത്തെ പ്രഭാഷണത്തിനായി സ്വാഗതം ചെയ്യാം. We are honored to have with us today a dear friend at BSI and one of the brightest medical minds. Welcome, Dr. Joy M.A. Over to you. Hello.
Thank you, Hafiz, for that kind introduction. And your introduction was very nice because some of the things which you told was new to me. One person who studied about sleep and all those things. So today I'm going to speak about how to get a sound sleep, and that's evidence-based strategies for better rest. So we should first understand why sleep matters, because sleep has got a lot of functions. It's mainly the more important for functions of the physical restoration and improvement of the immune function. It helps in memory consolidation and it improves brain health. It's very important for emotional regulation and mental health, and also prevention of various chronic diseases like say diabetes or hypertension. Starting from the ancient beliefs, people used to think that till about the early 20th century, people used to think that the sleep is just it's meant for rest. But in the 20th century, we found that with the innovation of or invention of electroencephalogram, that's we call EEG, we start understanding the different stages of sleep, like the REM stage, the NREM stage, etc. REM means rapid eye movement sleep. Rapid eye movement sleep means in that stage of sleep, the eyes will go on rapidly moving. In the non-rapid eye movement sleep, there won't be much of rapid eye movements seen in the sleep. Today, we know that as Hafiz was telling, the importance of sleep has been understood by human beings, and we have started using precision sleep medicine and personalization of sleep. So what happens during the sleep? What happens to the brain? It's very important that brain gets sleep, because we know there's a system called lymphatic system, like the lymphatic system which we have in the body. We have lymphatic system, which is specific or which is very peculiar to the brain. And this lymphatic system helps to detoxify the brain and remove the various toxins which are built up during the daytime. And brain activity, the importance of sleep is that there's something called neural plasticity, and whatever memory we store is getting consolidated during the time of sleep. And there's research on chemicals. You know that all the neurons work through chemicals called neurotransmitters, and the restoration of the chemicals mostly takes place during sleep. And there's an immune response activation also, which happens during sleep, which increases cytokine production, which would improve our immune function. So, as most of you would be knowing, there are 5 stages of sleep. It starts with wakefulness and drowsiness. So when you go to sleep, you're not asleep immediately on going to bed, immediately on lying on the bed. So we start with wakefulness, we go into drowsiness, and then we go through stages 2, 3, 4, and 5. The first 3 among the 2, 3, 4 stages is the NREM sleep 1, 2, and 3. As you go from NREM 1 to 2 to 3, at the 3rd stage, the sleep becomes very deep. So for restoration of
സ്ലീപ്പിനെ കുറിച്ച് പറയുന്ന ഒരാളുടെ സ്പീച്ച്.
So the deepest sleep happens in N3, that is NREM stage 3, and after that you go to the REM stage sleep. Now there's also always a confusion. People previously used to think that there's no the amount of sleep required depends on persons. Some people may require for 8 hours, some for 10 hours, some may be requiring only just 2 to 3 hours. But that concept has changed. So the recommended duration of sleep it varies between different age groups. So from 6 to 12 years of age, you may require some 9 to 12 hours per night. At the teenage, you may require some 8 to 10 hours of sleep. And adults 18 to 64, we may require 7 to 9 hours. So most of us who are hearing this will be requiring 7 to 9 hours of sleep per night. And older people, just 1 hour less. So it's 7 to 8 hours is required for older people who are older than 64 years of age. Now we'll come to the lack of sleep. That is technically called insomnia. There are different types of insomnia. Mainly 4 types. The onset insomnia means you have difficulty falling asleep. You go to bed, you're not able to sleep. Maintenance insomnia means you have frequent awakenings. You go to sleep normally, but in between you go on awakening. Especially for older people, it will be maybe for passing urine. And early morning insomnia is you may get up very early. Say if a normal person gets up at 6 or 7 a.m. in the morning, this early morning insomniacs would be getting up at 3 o'clock or 2 or 4 o'clock. And it's called a chronic insomnia when 3+ nights per week for more than 3 months is affected. Then you call the person a chronic insomniac. So what are the primary causes of disturbance of sleep which causes lack of sleep? The first and foremost thing, especially in the modern age, is modern age or older ages also. I think they've been stressed all the time. Whichever age there has been stressed. So as the modernity is increasing, the stress and anxiety is probably increasing. So that's the main cause for insomnia. Then with the advent of electronic media, tablets, and personal devices, the sleep hygiene has gone very down. It's very poor now. You go on using your phone until you get sleep. So that's going to impair your sleep. Then you got an irregular sleep schedule. Some of the people may not be able to sleep at night because of their work schedule. Some nurses who are working at night, or pilots, or people who have to IT industry who have to work at night. So they have an irregular sleep schedule, and they can't do anything about it. And one of the important things I already mentioned. So the screen used before bed, the screen has a blue light which suppresses melatonin, which is supposed to induce sleep. So that again would cause insomnia. Then there are secondary sleep disorders, like one of the commonest is restless leg syndrome. Now, if you would have heard this many a time. Many of your friends or your family members are telling you that they're not able to get sleep because they feel something abnormal in their legs. They feel that their legs are restless. They feel some itching. They feel some pain, karapa. A lot of things they say which keep them awake. So it's mainly a leg discomfort at night. And if they get out from bed and they start walking, the thing gets suppressed. So when they're lying down, what they try to do is they try to move their legs. So that's why it's called restless leg syndrome. You get some restless feeling in your legs. It's a sensation which makes you do a motor act. That is, you go on moving your legs. That's called restless leg syndrome. It's one of the most common movement disorders. They say that the most common movement disorder is what you call as essential tremor, where the hand goes on trembling when you try to fetch a glass of tea or something. Your hand gets trembled. That's the most common movement disorder. So the second most common movement disorder, which is described now, is restless leg syndrome. Now, if you get your friends telling you that they have problem with their sleep, just ask them what they feel with their legs at night. Then there's something called periodic leg movements in sleep. Then the patient may be sleeping, but involuntarily the legs will go on jerking, which would interrupt sleep. And the important cause for as cause of a sleep disorder is obstructive sleep apnea syndrome, where there's a lot of snoring. The respiratory movements are so difficult. Sometimes the patient goes into apnea, means there won't be any respiratory movements for some time. It may last for a few seconds, or even can last up to minutes. And once the carbon dioxide builds up because of the absence of respiratory movements, then again the brain gets stimulated and they'll start going to sleep. So all these disruptions, this sleep apnea would produce an increase in carbon dioxide in the body and also reduced oxygen. This will disrupt sleep. Although you may not get up from sleep, your sleep is not good if you have obstructive sleep apnea syndrome. Another thing which, especially for older people, is called the cramps. These are very common at night. You get nocturnal leg cramps where there's a severe pain and the muscle goes into contraction. So that will awake you from sleep. That's another important cause for insomnia. So again, as already mentioned, restless legs is an irresistible urge to move your legs, especially at evening and night. It may not be at night only. Maybe at 5 to 6 p.m., you start getting that symptoms when you're sitting down, and when it gets exacerbated when you lie down for sleep. The sensations could be like crawling, tingling, aching, or even itching. And some of these patients, restless leg syndrome is found to have associated iron deficiency, especially in the basal ganglia of the brain, or it could be a dopamine dysfunction. It's called a dopamine dysfunction because most of the drugs which work for restless leg syndrome acts on the dopamine system. And if you have iron deficiency, you treat the patients with iron supplementation. And if it's not because of iron deficiency, you start using drugs like dopamine agonists, like drugs called pramipexole or ropinirole. And even people use sleep-inducing drugs like clonazepam. Periodic leg movements, which I already mentioned, so repetitive involuntary jerks of legs or could be even of arms during sleep. The person is often aware unless told by the sleep partner, but it causes sleep fragmentation, and the sleep fragmentation causes daytime fatigue. And it can also co-occur, it can coexist with restless legs and sleep apnea syndrome. Then obstructive sleep apnea is the airways collapse repeatedly because the tone of the muscles in the throat is reduced. So the breathing pauses for about more than 10 seconds. The symptoms include loud snoring. And because of the disrupted sleep, they have increased daytime sleepiness. It's called excessive daytime somnolence. And they can have, because of this, can have morning headaches, they can have hypertension, uncontrolled hypertension. One of the most important causes obstructive sleep apnea syndrome. And it's most commonly seen in persons who are overweight, who are male, who are of more age, and whose neck are found to be, having a lot of fat and the passage is getting obstructed. But it's not a thing that people who are lean, who are female, who are not that age also can have obstructive sleep apnea syndrome. So it's getting more and more recognized. So the previous thinking was it was more in obese people, but now we find patients who have lean and who have obstructive sleep apnea syndrome. And the treatment is by using what you call positive airway pressure. You put a machine and something like a ventilator without a endotracheal intubation. You put it on the face and covering the nose and the mouth, and the machine gives you a pressure so that the muscles which are lax in the neck region gets dilated and the thing is taken care of. Previously, we used to have only this CPAP method. Weight loss is a good treatment for that, but many of the people may not be able to lose weight in spite of food restriction and all those things. But now there are newer medicines which are coming up. Without CPAP also, you can get relief from obstructive sleep apnea syndrome. So yesterday, Shibu was asking me, he has got obstructive sleep apnea, so he's using a machine to sleep. Sorry for divulging that, Shibu, but it just came out of my mouth. So there are medicines. So drugs like atomoxetine, which is used in, you would have heard of attention deficit hyperactivity syndrome, where for the hyperactivity, you give atomoxetine. And this medicine is supposed to work for obstructive sleep apnea also. So I read this because I was preparing for this talk. And so I just looked up what are the recent advances, and atomoxetine was mentioned. So I tried in 1 or 2 patients, and those patients appear to be more comfortable now. Okay. Now, to get a good sleep, what is the sleep environment which is required? In the West, they say that the ideal temperature for sleep, they set their air conditioners or air coolers to about 19 to 20 degrees centigrade. But in Kerala, it said that the optimal temperature would be about 25 degrees. So you should not put your AC less than 25. It's always best that if you have a problem with sleep, you have a blackout curtains, and there should not be any night lights. And it should be very quiet. So some people use a white noise machine. And if in the Facebook, you can see a lot of advertisements of the various sounds which would help you to improve your sleep. And bed should be used only for sleep. And other than sleep is just for intimacy. So you should not work on your bed if you have problem with sleep. Otherwise, you can work on your bed. If you have problem with sleep, don't work on bed. Don't lie down on bed and watch TV or use your mobile phone and things like that. Then there is the most effective treatment without medications in psychiatry, especially in psychological treatment. You use cognitive behavioral therapy. So you use a stimulus control. You use your bed for only sleep or intimacy. And the sleep, you should use your bed only for sleep. You shouldn't go on lying on the bed without sleep. Then it's not a good thing. Then once you don't start getting sleep, you start feeling anxious that why you're not getting sleep. So what happens tomorrow? So if I don't sleep well tomorrow, what will happen to me? So you just don't try. Being anxious by thinking about all those things. And you can also use various relaxation techniques like progressive muscle relaxation. Coming to sleep medications, a lot of medications which are used, of which the natural hormone is a melatonin, which is available as a tablet. Then previously we used to use benzodiazepines like clonazepam and diazepam, but benzodiazepines have got a very high dependence risk. And if you continuously use benzodiazepines, there's also an increased chance for instance of dementia also, just because of use of continuous benzodiazepines. And people used to use antihistamines, alcohol as sleep aids. I'll come to that. Alcohol is not at all a sleep aid, but a lot of people we see Andra we slept off. So people think that alcohol is a soporific. It's not. It's not really. So one of the best newer medications is called lemborexant. The trade name one is Davigo. It's an orexin antagonist, a new class of drug which is doing a lot of good in patients who have problems with their sleep. Now I'll go to some sleep myths. People think that you can always catch up your sleep on weekends. But the fact is that consistency matters more. Irregular schedule worsens your sleep. Now, the second myth is alcohol helps you sleep. The real fact is that alcohol disrupts your REM sleep and causes fragmentation of sleep. So it's not really helping your sleep, although you feel that you're getting a good sleep with alcohol. So what about afternoon naps? I mean, a lot of people ask us, what will afternoon nap do to your regular sleep? So the maximum afternoon nap you should go for is only about 20 to 30 minutes and should be before 3 p.m. If it's after 3 p.m., it's going to disrupt your nighttime sleep. And some people ask, how long will it take for the sleep medicines to act? If you start the first day, will it act? It can act in a lot of patients, but in some people, it may take about 1 to 2 weeks for the medicines start acting. So after 2 weeks only, you take the medicine, and then regularly you start getting sleep. So what are the quick sleep hygiene you can use? You keep consistent sleep schedule, even on weekends. Weekends, it's not as much in our part of the country or our part of the world, but in the West, weekends are almost majority of people won't have good sleep because they try to hang out in the groups or in pubs. So your sleep schedule should be very consistent, including those on weekdays. Then you should put off all the screens 1 hour before bed. You should avoid taking caffeine, that's coffee, after 2 p.m. You can take at 4 p.m. if you don't have a problem with your sleep, but if you have a problem with sleep, you avoid coffee after 2 p.m. Then exercise is good. You take exercise at least about 3 to 4 times per week. And the best exercise would be to do it in the morning and the afternoon and not closer to your sleep. Poor sleep can cause serious illness. Chronic insomnia can cause increased cardiovascular disease, means like a heart attack and strokes can increase because of poor sleep. Poor sleep can cause higher diabetes and obesity risk. This fragmented sleep, as in obstructive sleep apnea syndrome or periodic leg movements in sleep, can cause cognitive decline and dementia just because of lack of good sleep. That can itself lead to cognitive decline and dementia. So the message is that sleep is preventive medicine. So if you get good sleep, you avoid a lot of diseases going to happen. So what is this 24-hour body clock? The circadian rhythm, which is there for the 24 hours. There's an internal cycle of circadian rhythm. If the light exposure resets the clock each day, depending upon the light exposure. If there's a disruption of your sleep, like a jet lag and shift work problems, can reset your internal circadian rhythm. So if you can optimize the circadian rhythm by exposing yourself to a bright morning light, and evening you put off all the lights, and dark evenings will give you a good circadian rhythm. Now coming to the melatonin, which is supposed to be the hormone which was previously thought that's inducer of the sleep. Melatonin is released when it gets dark. Blue light from screens suppresses the melatonin production. So that's why if you use your screens, if you use your phones, or if you use your computers towards the sleep, it's going to suppress the formation of melatonin, and that will reduce your sleep. So what happens when you're exposed to blue light, your brain always stays alert at night. Solution is that you should use no phones or that electronic devices 1 hour before bed. Now, coming to sleep and immune function, which I already mentioned previously, is immune cells multiply during sleep. Cytokines, which are, important for infections, and cytokines function against cancer, also inflammation. So that's their production is increased during sleep. So if you have a short sleep, there's an increased chance for infection because your immune function is less. And poor sleep also reduces your vaccine response. So if you get a vaccine and if your sleep is reduced, there's a chance that the vaccines work less in you than a good sleeper. Then there are some foods that support sleep. Magnesium is supposed to improve sleep, and magnesium is supposed to be very high in things like almonds, spinach, and pumpkin seeds. Tryptophan is supposed to be a good thing for sleep, and tryptophan is supposed to be high in chicken and turkey in the US. So for us, chicken and cheese. If you use warm milk before bed, it contains calcium and tryptophan combination. So warm milk is good. If you have problem with sleep, you can try that. Some people even use plantain, which is so much available in Kerala. So it also contains some chemicals like tryptophan, which would improve your sleep. Exercise can improve the sleep quality. So if you regularly do exercise for about 30 to 60 minutes say about 5 days a week, deeper stages of sleep becomes more restorative if you exercise regularly. And the timing of the exercise should be in the morning and afternoon and should not be close to the bed. Things like yoga and stretching also can be beneficial, especially by causing muscle relaxation, can also improve your sleep. Then you can, I said one of the most important things for insomnia is stress. So there's something called a worry journal, where you take a book and note down all the worries you have when you're about to sleep. And you put down the worries on a page and you tell that put it aside for tomorrow. Then don't think about it. Then there's something called a deep breathing technique, which is called 4-7-8 technique. The 4-7-8 is 4 seconds, 7 seconds, and 8 seconds. What you do is you inhale with your mouth open. You can inhale for 4 seconds. Make it 4 seconds by counting 1 to 4 slowly, as if 1 per second. And after that, you hold your breath for about 7 seconds. You count for 7 till 7 and you hold your breath. And after that, you exhale, maybe with your mouth open, and it should last for about 8 seconds. So if you do that, these deep breathing exercises would improve or increase a vagal tone, which is a parasympathetic system, which usually puts you to sleep. The sympathetic system makes you alert. The parasympathetic system makes you help you sleep. So by doing a deep breathing technique where this 4-7-8 technique is used, the vagal tone would be increasing, and that would improve sleep. Now, coming to meditation, if you do 10 to 15 minutes before bed, that would improve sleep. And warm bath. That's one thing which I always tell my patients. You take a warm bath, the maximum temperature which you can sahikkamba down the chudu. So the maximum thing. So if you do that, there'll be some relaxation of muscles, and there's a body temperature regulation, which again can improve your sleep. So that is a warm bath towards your sleep, towards the night. Yeah. There's something called progressive muscle relaxation, which should help you to sleep. That is, you tense each of your muscle group about 5 seconds, then release. You should start from your toes. From your toes, you can start. You tense that for 5 seconds and then let it go. Relax. Then you take the feet, then come to your legs, thighs, your body, your upper limbs, your neck, your face, neck, and all that. So if you tighten for 5 seconds and then release, if you practice that for 10 to 15 minutes, it would improve your sleep. So if you're finding it difficult to sleep, a lot of people who are very lucky that when they just go into bed, they just sleep. It's not for people like that. For people who are finding it difficult to sleep, people who are called insomniacs, you can try this progressive muscle relaxation. Then what are sleeps about us, which have to be avoided? Caffeine. If you're not you have a poor sleeper, you should avoid caffeine after 2 p.m. You should avoid large meals close to bedtime, because large meals would take a lot of blood flow to your stomach. So you should avoid, as far as possible. Now they say that dinner should be always be before 7 p.m. We find a lot of people eating at 8, 9, 10, 11 and all that. So your dinner time is ideally, it should be before 7 p.m. Alcohol, as I already mentioned several times, a sleep disruptor. So you should not use alcohol for sleep. You should use alcohol if you want for socialization. Socialization is a good thing. It's one of the best things which, as Hafiz said, what would do, which is the best thing which should improve your age or increase your longevity. They say socialization. So the thing about alcohol is that the real effect is that it suppresses your frontal lobe function. Frontal lobe is a thing which makes you control yourself and makes you inhibited. So once alcohol starts working on the brain, it inhibits the frontal lobe. So your inhibition is gone. You start talking. So alcohol helps in socialization. Thereby, it may be helpful for longevity. But as a sleep enhancer, alcohol is not good at all. Now, the special challenges is for the shift workers. Their circadian rhythm is completely disrupted because of irregular schedules of work. So what's the strategy for them? I think there'll be a lot of people who are hearing this. I know in Bauma, a lot of people who are having this shift work and all that things. So whenever you start the shift, you should work in a very bright light. And when it's time for you to sleep, even if it's in the daytime, you should make the environment dark. And if you're not getting sleep, then you should try melatonin. Melatonin is supposed to be a thing which is there in your body, so it cannot be called a drug as such. So if you take melatonin, which can be from 0.5 milligrams or 3 milligrams to 3 milligrams, then it would induce sleep. So if you're not getting sleep, you can try melatonin. If you're sleeping in the daytime, you can try melatonin in the day. But all these people who work as shift workers in long term, there's always an increased disease risk. So how to overcome that, I don't know. You will have to find out yourself from your kind of work. Now you have sleep debt. Sleep debt means you slept, you're supposed to sleep for 8 to 9 hours. You slept only 4 hours today, 4 hours tomorrow. So what happens is that rest 4 hours? Can you make it up in the weekend? Yeah, you can do that in short term. You can partially recover. But long term, you go on having sleep disruption for several weeks, there'll be an accumulated damage. So it may take months to get restored. So the best strategy is that consistent sleep. Even on the weekends, you should have consistent sleep. So weekend recovery helps, but it doesn't fully compensate. Now, a talk on sleep would be incomplete if you don't talk about dreams. What is the purpose and function of dream? Mostly dreams occur in REM sleep. That's a rapid eye movement sleep, which happens about 20 to 30% of your sleep is constituted by REM sleep. And REM sleep is the one where you get most dreams. What's the function of dream? Mainly emotional processing. And more than that, most of your memory, if you are a student, if you study well, and if you don't sleep properly for prior to the exam, your memory won't get consolidated. So it's very important that you sleep well before your exam days. So otherwise your memory will be haphazard and you may not be reaping the benefit of whatever you studied. If you get vivid dreams, it indicates that you had a very good sleep quality. And there are some drugs which can impair dreams. There are some drugs which can cause frightful dreams, especially drugs called beta blockers like atenolol. Many of you may be taking atenolol or propranolol or things like that. Metoprolol. Metoprolol is very commonly used now. So these drugs are called beta blockers that can cause very fearful dreams, which is also not good. Now coming to managing jet lags, you should have a gradual shift. 3 days before travel, you should start adjusting to the time zone where you're going to go. And light exposure, bright light in the morning especially if the travel is towards the east. And if you have a problem, you can take melatonin 0.5 to 3 milligrams at your new bedtime. And recovery takes about 1 day per time zone crossed. Sleep and brain performance. If you have sleep loss, you have decreased attention, your reaction time is prolonged, your learning is impaired. Your deep sleep, if you get a deep sleep, your memory gets consolidated for facts and also for skills. There's something called motor memory, that your skills are supposed to be a memory again of your motor function. So that also gets better by good sleep. REM sleep helps in creative problem solving and insight. So many of the literators or the people who write and scientists who suddenly get a big idea. It may be because they're getting a good sleep and they're having an REM sleep, which may be helping them to get better new ideas. If you lose one night's sleep, what happens to your performance? Your performance drops by about 30%. So that's a significant number. When should you seek professional help if you have a problem with sleep? If the insomnia, if the lack of sleep persists for more than 3 months despite sleep hygiene. So I mentioned to you a lot of sleep hygiene methods which you can adopt for improving sleep. If you don't get sleep in spite of 3 months of trying those, you should see a doctor. If you have loud snoring and daytime sleepiness, that's called excessive daytime sleepiness, you should consult a doctor. If you have restless legs or periodic limbs, so by now you know what restless legs is. You can even discuss with your family members, because I find a lot of people with restless legs not properly diagnosed, and they don't know what's going on. Even they would have seen even doctors also, but it's not recognized properly because it's a rather newly described disease, maybe some 20 or 30 years it has been described. So it's not a it would have been there for very long time, but it's being recognized more and more often now. So sleep affects work, mood, relationships. So if it affects mood, relationships, etc., you should see a doctor. Now, there are a lot of sleep studies you do. It's called polysomnography. So if you go and see a doctor, so what should you expect? The doctor might suggest to you that you should do certain tests. The first thing among this is polysomnography. Polysomnography is something like EEG, which you do for seizures. You monitor the brain waves, your heart, your pulse, your breathing pattern, your muscle tone, and all that. And that would help you to diagnose things like obstructive sleep apnea syndrome, etc. is mainly diagnosed by polysomnography. And even these tests used to be previously done only in hospitals, but now we have gadgets which can be used at home. You can take the gadget home. The gadget provider, the companies would come and fit you with the polysomnograph at home. So you not go to the hospital to get this polysomnography done. There's something called multiple sleep latency test, which is usually done for people who have excessive daytime somnolence. There's something called narcolepsy cataplexy syndrome, where the people will suddenly sleep during the daytime. Even if they're doing some interesting work, they fall asleep. So this is called narcolepsy cataplexy. For that, you do this multiple sleep latency test, where the sleep latency will be very short. For normal people, when you're asked to sleep, it will take some time. So for these people with narcolepsy, the thing is they suddenly fall asleep. Go to bed, they just sleep off. There's something called actigraphy. Actigraphy is something like a watch. It's a wrist device which will trap your sleep and wake pattern, and doctors can come to diagnosis using that. So as Hafiz was telling, there's a global sleep crisis. 3% of adults get insufficient sleep globally. 10 to 30% suffer from chronic insomnia. 1 to 5 have undiagnosed sleep apnea. And the economic cost is saying the US is about $400+ billion. So I did a survey because Lyons, after he gave me this topic, I did a survey among the Baumians, and the split up was that most of the people had good sleep. Some 16 had good sleep, and some 6 to 7 really had problem. Then I did the same thing among the doctors, which Hafiz was telling, the MD-Days group in WhatsApp, which contains about 800 doctors, but only about 60 or so responded, of which some 60 to 70% had problem with sleep. So Baumigas, I think, better when compared to doctors on getting good sleep. So how sleep changes with age? When you're young, you have more deep and REM sleep. It's got a better efficiency. Middle age, your sleep quality declines. Older adults, it becomes more fragmented. They wake earlier, and most of the fragmentation of sleep is because of the need to pass urine during nighttime. Some people get up some 3 to 4 times to pass urine. So it again takes time for that person to get sleep back again. So what are the solutions for this? Adapt sleep hygiene and manage your expectations. Then there are various natural sleep remedies, which I already mentioned, plantain and all those things. There are things like valerian root. I'd send you the Malayalam for all these things. I didn't know the Malayalam for this. Is something called Valerian root, which has modest benefits. Then there's something called chamomile tea. It's also available in Kerala. There's a Malayalam for that. It gets a mild relaxation effect. There's lavender aroma tea. It has got a small but real benefit. Then some passion flower. That's our passion fruit. It's traditional use. There's a limited evidence that it can improve your sleep. So the 5 takeaways is that your consistency would matter. Your environment should be cool, dark, quiet. Behavioral methods of treatment is much better than medication. If your behavioral methods, like you can try cognitive behavioral therapy, which are available in the applications. You can download the application for cognitive behavioral therapy, and you can do that. You should exercise, especially in the afternoon or in the morning, not towards sleep. No screens for at least 1 hour prior to sleep. Sleep is health. So it's the best thing to invest in for your health. Previously, people used to think that diet is good. Then people started saying exercise is very important. But now they say the most important thing for your health is sleep more than exercise or your diet and everything. So sleep is a most important thing. So sleep is not a luxury. It's your biological right. Now, I was just going through the latest things in sleep yesterday. So I found that there's an app-based cognitive behavioral therapy, which you can download and use. And yesterday I found that Tai Chi, which is a very incoming exercise thing, is found to be useful for inducing sleep. So if therapy is not accessible, if your psychotherapy is not accessible, then you can use digital cognitive behavioral therapy applications and Tai Chi as as a method for inducing sleep. Then this sleep exercise with a sweet spot, you should do 30 minutes of exercise 4 days per week of moderate intensity. It improves your sleep significantly in all age groups. Which are the main exercises which works best? Walking, cycling, swimming, yoga, resistance training, and also Tai Chi, the new one. And the timing, the exercise earlier in day, or at least more than 3 hours before bed, you should exercise. So your complete sleep toolkit would be, the first thing with no cost is sleep hygiene with cognitive behavioral therapy and regular exercise. Tier 2 is digital CBT app or things like Tai Chi class. Tier 3, brief therapist support. And if you're not getting improved with that, the final thing would be medications, which are always best avoided because most of them are habit-forming medications. You will get addicted to that, hooked to that. So after some use, you won't be able to come off from that. So medications, always don't try to use. Thank you.
നമുക്ക് മൂന്ന് ചോദ്യങ്ങൾ കിട്ടിയിട്ടുണ്ട്. അത് ഹരിദാസിന്റെ ഒരു ചോദ്യമാണ്. ഹൗ ഡു യു ഡയഗ്നോസ് സ്ലീപ്പ് ആപ്നിയ അതിന്റെ ഏർലി സിംറ്റംസോ അത് ഒന്നുകൂടി എക്സ്പ്ലെയിൻ ചെയ്യാൻ പറ്റും ഡോക്ടർ?
Yeah, the most early symptom is you get excessive daytime sleep. You feel, or even before that, it's not early excessive daytime sleep. People complain of that, but the most important thing is if you have got a partner on bed, they'll be complaining that they can't sleep because of your snoring. So that's the earliest thing. Then finally, you can go into excessive daytime sleep, your uncontrolled hypertension, and diabetes and all that. So the first thing would be snoring.
Okay. How long can we be on sleep medication? That's from Dr. Nisha Francis.
Okay, Doctor,
Dr. Nisha Francis. How long can
you be a medical doctor?
I'm not sure about it.
Okay, right, yeah. So it's always best to avoid. It's always best to avoid. So if you try every other thing and it's not working, you try. But how long?
How long can be on medication?
Yeah, if you're not getting sleep for say months together, what do? You take every day. So it depends on your need. So it's best always to avoid, but there's no other way for you to get sleep, then maybe you'll have to take it. And how long to take it depends on how long you don't get good sleep. So, but the problem is that if you use things like benzodiazepines, you'll have to go on increasing the dose.
Okay.
So the same dose will not work after some time. So it's going to be a trap. So better not use.
Hope it's clarified. Sham Kumariam, what is the problem with occasional antihistaminics for sleep induction?
That's what I mentioned. I had mentioned in the drug chart. It's always better that you don't use antihistamine. It's not a good medicine for sleep as such. The things I usually write is melatonin. Now I'm using a lot of lemborexin. That's that orexin medicine, but it's very costly. 5 milligrams, I think, cost about 50 rupees, and 10 milligrams around 89 rupees. So it's very costly. So, but it's very found to be very effective. And if there's no other way, if you not get sleep with melatonin, and if you can't afford that lemborexin, then I use clonazepam. There may be some controversy whether to use clonazepam or not. You don't use diazepam these days, but you can try clonazepam. But it's always better not to use medicines for sleep induction.
I think you mentioned plantain water. Somebody is asking what is meant by plantain water.
That was I think I just came out with that. I think it just meant plantain. It means you take plantain and contains. Water was a mistake. Sorry for that.
Biju Cherian has asked, I joined late. Is there something called excess sleep? Yeah.
That's what I said. He missed the bus. So there's excess sleep. Excess sleep means you sleep at night and then you get again sleep in the daytime. It may be because of a disrupted sleep at night because of steady sleep apnea and things like that. You don't get a good sleep and you sleep in the daytime. And then I also mentioned narcolepsy. Narcolepsy is a condition where you get good nighttime sleep. It may also be disrupted, but it's much better than the people with OSAS, obstructive sleep apnea syndrome. You get a good sleep at night, then again you feel excessively sleepy during daytime. It's called excessive daytime somnolence. And one of the most important reasons for that is narcolepsy, where the other confounding things or the other features which can exist with narcolepsy is excessive daytime sleepiness and something called sleep paralysis. You get up from sleep and you find that you cannot move your limbs. That's called sleep paralysis. There's something called hypnagogic hallucination. When you go to sleep, you get dreams only towards the latter part of sleep. But in case of narcolepsy, you sleep and you start getting dreams. That's called hypnagogic. There's something called catalepsy. That is when you have an emotional outburst, you laugh, suddenly you fall down. You lose your muscle tone. When you laugh or you have an emotional outburst, that's also again a feature of narcolepsy. So this one condition where you can have excessive daytime sleepiness. And there's something called idiopathic hypersomnia. It's not narcolepsy. It doesn't have other features of narcolepsy, but you feel sleepy throughout the day. So there are medicines for that. There's something called modafinil and things like that which can improve that excessive daytime sleepiness.
Okay, നമ്മൾ ഉച്ചയ്ക്ക് ഉറങ്ങുന്നുണ്ടല്ലോ. അപ്പോൾ സാധാരണ 20-30 മിനിറ്റ് കൂടുതൽ ഉറങ്ങരുതെന്ന് പറയും. Which again I discussed with you. ഉച്ചയ്ക്ക് ബോഡി ടെമ്പറേച്ചർ ലോ ആവാറുണ്ട് നാച്ചുറലി എല്ലാവരുടെയും.
In the Gulf, people
sleep for 2-3 hours. But what I noticed is ഒരു 30 മിനിറ്റിന് മേലെ ഉറങ്ങിക്കഴിഞ്ഞാൽ നമ്മൾക്ക് രാവിലെ എഴുന്നേൽക്കുന്ന ആ ഒരു ഉന്മേഷം കിട്ടില്ല. നമ്മൾ ആ ഒരു തളർന്ന പോലെ ആവുന്നുണ്ട്. Why is it? What is the difference between ഉച്ചയ്ക്ക് ഉറങ്ങുമ്പോൾ എപ്പോഴും തളർച്ചയോടുകൂടി എഴുന്നേൽക്കുക, ചെറിയ പവർ നാപ്പ് അല്ലെങ്കിൽ? What could be the reason for that?
നീനോട് ചോദിച്ചു, പക്ഷേ ഉത്തരം കണ്ടുപിടിക്കാൻ മറന്നുപോയായിരുന്നു. There should be some reason. I don't know.
Because ഇത് ഓർമ്മ വന്നു വെച്ച് കഴിഞ്ഞാൽ ഇപ്പൊ ആ നമ്മുടെ ഒരു തളർച്ച ഫീൽ ചെയ്യുന്നത് പറഞ്ഞപ്പോഴ് അപ്പൊ is it anything to do with that? That's what I ask. പിന്നെ നമ്മളുടെ ഇപ്പൊ ഫോർ എക്സാമ്പിൾ ഐ പ്രാക്ടീസ് ഹിപ്നോട്ടിസം. അപ്പോൾ നമ്മൾ സ്ലീപ്പ് എന്ന് പറഞ്ഞിട്ടാണ് അവർ ഓർക്കുക. ബട്ട് ഐ നോ ദാറ്റ് ദേ ആർ ഇൻ അലേർട്ട് കണ്ടീഷൻ, ദേ ലിസൺ എവറിത്തിങ്. So what exactly is the difference between that sleep, like a trance? Most of the people go in trance. വണ്ടി ഓടിക്കുമ്പോഴോ അല്ലെങ്കിൽ കണ്ണടച്ചിട്ടാണ് ട്രാൻസിൽ പോകുന്നത്, പക്ഷെ they are alert. So will that അതിനും ഇതേ സെയിം സ്ലീപ്പിന്റെ rejuvenation ഒക്കെ കിട്ടും?
It's not sleep. Hypnotism is not sleep. You're not sleeping, you're alert. So it's completely different from sleep. So you won't get any benefit of sleep by getting hypnotized. So they use it to maybe they read your mind. I don't know whether they will be able to read your mind, but they will be able to influence you. But hypnotism is not sleep. So there's no similarity between hypnotism and sleep.
ഞാനൊരു ഇൻസോംനിയ ബാധിച്ചൊരു കക്ഷിയെ കണ്ടിട്ടുണ്ട്. He has not slept for almost 20-25 years altogether. അപ്പോൾ അങ്ങനത്തുള്ളവര്, and he's fine with everything and he's very good and very productive. So what kind of activities are going within his body and brain? Can you explain?
He claimed that he didn't.
He came to me. He wanted to find a way, because എല്ലാവരും ഉറങ്ങുന്നു, അവരെന്താ ചെയ്യണേന്ന് അറിയാൻ വേണ്ടിയിട്ട് ഉറങ്ങാൻ പറ്റുമെന്ന് അറിയാൻ വേണ്ടിയിട്ട് വന്നിരുന്ന ഒരാളാണ്. Otherwise he doesn't have any problem.
I think it's impossible. It's impossible for any human being to live without sleeping for 25 years. Mostly the problem is with the perception. A lot of people complain that they don't have good sleep, but they're having good sleep. So people think that they're not having sleep, but they have good sleep. So this can be easily proven by doing a polysomnography. And you put that person, you ask him to come and see me, we'll do a polysomnography, and you can show him that he's sleeping by the...
Then I want to ask another question is polyphase sleeping. Uberman sleeping set കുറേ നാളായിട്ട് യൂണിവേഴ്സിറ്റി സ്റ്റുഡൻസ് ഒക്കെ ചെയ്യുന്നതാണ്. Every 3 hours ഉറങ്ങും for half an hour. So like 24 hours they get around 3 hours of sleep, and because they want to use that time for productive stuff. What do you think happening there? And some research they say ഈ polyphase sleeping ഈ cycles break ചെയ്യുമ്പോൾ they get body will try to get the 5 phases of sleep like REM every time you break in sleep. അപ്പോൾ ഇതില് ഒരു 4-6 പ്രാവശ്യം ഉറങ്ങുമ്പോഴേ ഒരു ദിവസം break ചെയ്ത് ഉറങ്ങുമ്പോൾ they get all the 5 phases of sleep. But I'm not sure about it. Whether do you have any idea about that?
I don't think it's true. I tried referring that, but I forgot what I actually read. But I think it's not effective. As just like nighttime sleep for 8 hours, and this breaking sleep is not good. So you should have if you have to have a good restorative sleep, you should have a nighttime sleep for 7 to 8 hours. This breaking sleep, I just looked into that. I think it's not true.
Okay.
That they have a restorative sleep and they get all the cycles. These cycles, the whole 5 won't start from the first cycle itself.
Okay.
It takes some time for the REM to come in.
Okay. നമ്മൾ ഈ ഭക്ഷണം കഴിച്ചു കഴിഞ്ഞാൽ ഉറക്കത്തിന് ഡിസ്റ്റർബൻസ് ആവുമെന്ന് പറയുന്നുണ്ട്. പക്ഷെ നമ്മൾ നല്ലൊരു മീലൊക്കെ കഴിച്ച് കഴിഞ്ഞാൽ പെട്ടെന്ന് ഉറക്കവും വരുന്നുണ്ട്. So how can both contradict to each other then why they are asking to sleep?
I think it's because if you have a full tummy, that maybe most of the blood goes to the stomach for the digestion. Your brain gets less blood. Your brain becomes has lack of energy, so it's put to sleep. That could be one reason. So why shouldn't it work at night time if you have a big meal and if you don't sleep? I didn't think about it, so I think I should refer once again why people say that you should not have a big, full stomach when you get to sleep, and that by having a big meal you can get sleep. So I'm not sure. I'll refer and send you the thing to Baumam.
And one more with the question also is there about power nap. ഇപ്പോൾ ഒരുപാട് ആൾക്കാർ ചെയ്യുന്ന കാര്യമാണ് ലെസ് ദാൻ 25 minutes പവർ നാപ്പ്. ഈവൻ ഒരുപാട് ചൈനീസ് റീൽസ് ഒക്കെ തന്നെ കാണാറുണ്ട് കുട്ടികൾക്കൊക്കെ പവർ നാപ്പ് കൊടുക്കുന്നതൊക്കെ. സോ ഹൗ എഫക്റ്റീവ് ഇസ് ദിസ്? ഒരു ഇടയിൽ വെച്ചിട്ട്, നോട്ട് ഈവൻ ഉച്ചയ്ക്ക് മാത്രമല്ല, ഭക്ഷണം കഴിഞ്ഞിട്ട് സിയസ്റ്റ മാത്രമല്ല, ഇടയിലൊക്കെ വെച്ചിട്ട് നമുക്ക് ഒട്ടുമിക്ക കോർപ്പറേറ്റ്സ് ഒക്കെ അതിന് സമയം അനുവദിക്കുന്നുണ്ടെന്ന് പറയുന്നുണ്ട്, ഒരു 20 minutes ഓഫ് പവർ നാപ്പ്. How effective is power nap to rejuvenate your brain and body?
It's supposedly good, but again, and Yeah, I read about that. Supposed to be good, but I don't have scientific numbers to quote.
Yeah.
So
One more question I wanted to ask is about the somnambulism. People who walk in the night, what happens to them when they walk? I don't know, people listening to, എനിക്കറിയാവുന്ന തന്നെ ഒരുപാട് റിലേറ്റീവ്സ് ഈ സ്വപ്നാടനം നടത്താറുണ്ട്. അപ്പൊ അത് അവർക്ക് തന്നെ എഫക്ട് ചെയ്യോ റിയലി? ആൻഡ് ഇസ് ഇറ്റ് വാട്ട് എവർ ദ സ്റ്റോറീസ് ഓൾ ഹേർഡ് അബൌട്ട് what you say, somnambulism is right because they drive, they go അങ്ങനെയൊക്കെ ഡ്രൈവ് ചെയ്തിട്ടൊക്കെ പോയിട്ട് എന്തെങ്കിലും കാര്യങ്ങളൊക്കെ ചെയ്ത് വരുന്നൊക്കെ പറയുന്നുണ്ട്. പക്ഷെ നടക്കുന്ന ആളെ കണ്ടിട്ടുണ്ട് ഞാൻ. പക്ഷെ can you elaborate on that?
that's your trump card. I was not prepared for that.
Yeah, okay, so
I'll try.
it's a vast subject.
Sleepwalking.
Yeah.
Sleepwalking. You walk in the sleep, you walk in the sleep, but you're not aware of that.
Yeah.
There's something called sleep eating. You go and eat, but you're not aware of that. So it's called a parasomnia. Parasomnia means it's a problem which happens in sleep. It's a disease which happens in sleep. So somnambulism is there. I don't think people are fully conscious. They don't have memory for that. They don't recall that. But some of the things which they do can be felt as if it's normal. They do the correct thing. They go to the fridge and they take the food and they eat. So they are conscious during those episodes, but the next day they won't be aware. So somnambulism is a true thing. So again, did that answer your question or?
Yeah. I just wanted to have your idea because നമുക്ക് നെറ്റിലൊക്കെ കിട്ടുന്ന കുറച്ച് കാര്യങ്ങളല്ലാതെ I just want to have some scholarly ideas about
Supposed to be a parasomnia. There's things like called night terrors, nightmares. Means people suddenly children especially get up from sleep and just cries out and things like that. Night terror, nightmare. Night terror happens in REM or in REM sleep. The other one, the other sleep. So a lot of parasomnias there. So this somnambulism is one. Sleep, eating is one.
And the interesting thing about, you talked about a few supplements and other natural herbs, natural supplements ഒക്കെ പറഞ്ഞിരുന്നു. I remember നമ്മളുടെ നാട്ടില് you're talking about milk as well. ഒരു ചൂടുള്ള പാല് കുടിച്ചു കഴിഞ്ഞാൽ ഉറക്കം ഒരുപാട് ആൾക്കാർക്ക് അത് ഹെൽപ്പ് ചെയ്തിട്ടുണ്ടെന്ന് കേട്ടിട്ടുണ്ട്. ആൻഡ് നമ്മുടെ നാട്ടില് ഹോർലിക്സ് എനർജി ഡ്രിങ്ക് ആയിട്ടൊക്കെ കൊടുത്തിരുന്നത് ഐ ഹേർഡ് UK അതൊരു ഉറക്കത്തിനുള്ള ഇതായിട്ടാണ് അഡ്വർടൈസ് ചെയ്തിട്ടെന്ന് പറയുന്നുണ്ട്, ടോട്ടലി ഓപ്പോസിറ്റ് ആയിട്ട്. സോ ആൻഡ് ഐ നോ ഫ്യൂ പീപ്പിൾ ഹാവ് had Horlicks and used to sleep as well.
Many elderly people here, they still use it as to enhance their sleep.
Really? Okay. He's from UK, Madhu. Our chairman, BSI, is from UK. അവിടെ സ്ഥിരമായിട്ട് ഹോർലിക്സ് ഉപയോഗിക്കാറുണ്ട് അല്ലേ?
ഇപ്പോഴും അമ്മൂമാരോട് സംസാരിക്കുമ്പോ അവര് വൈകുന്നേരം ഹോർലിക്സ് കുടിച്ചില്ലെങ്കിൽ ഒരു ബുദ്ധിമുട്ടാണ് അവർക്ക്.
യമുനയ്ക്ക് എങ്ങനെയാ?
അമ്മൂമ്മ ആയിട്ടില്ലാത്ത കാരണം.
One more question I want to ask before Dr. Nisha again asking, is sleeping late in the night, that is towards early morning, and sleeping late into the afternoon compensate for the night sleep? നമ്മളത് ഡിസ്കസ് ചെയ്താണ്, ഒന്നും കൂടി ഒന്ന് ക്ലാരിഫൈ ചെയ്യാൻ പറ്റുമോ?
They say it's best that you sleep at night.
അത് റെഗുലർ ടൈമിംഗില് you have a proper discipline അല്ലേ?
Yeah.
I hope it is clear. And one more thing, നമ്മള് ഈ weight lossന്റെ കാര്യത്തിൽ വരുമ്പോൾ there is a hormone called ghrelin which sleep affects ghrelin, lowers and it creates hunger. അതുകൊണ്ട് സ്നാക്കിങ്ങിന് കൂടുതൽ ചാൻസ് ഉണ്ടെന്ന് പറയുന്നുണ്ട്. സോ നമ്മളുടെ ഓവർ ഈറ്റിങ്ങിന് ഇതാണോ ഈ ഉറക്കമില്ലാത്തവർക്ക് ഉറക്കം കുറഞ്ഞു കഴിഞ്ഞാൽ ചാൻസസ് ഓഫ് ബിക്കമിങ് ഓവർ വെയിറ്റ്, ഈസ് ദാറ്റ് കുഡ് ബി ദ റീസൺ?
Yeah. Okay. And one of the newer medications used for diabetes is called semaglutide.
Okay.
Ozempic. You have heard of Ozempic. Ozempic faces and all that. Ozempic faces means you get so thin that your face becomes then Karan Johar and all.
Karan Johar, yeah.
So it's used for weight loss. It's diabetes, but
it's considered as a longevity drug. ചിലര്
supposedly, but it has got a lot of adverse effects also. The most adverse effect is to your pocket. It costs around probably some 300 rupees per day. So it comes to around 10,000 rupees per month in Kerala. But in US or UK, it's going to be much, much higher. So other than that, a lot of adverse effects for, but if you can tolerate that, and if you are, I've seen people who have lost some 30, 40 kg weight in 1 month,
on Ozempic.
semaglutide. So that's very extreme case, but a lot of people lose their weight because by using semaglutide. Semaglutide is supposed to be a good treatment for obstructive sleep apnea syndrome also, because it brings down weight, and again your snoring and all can be taken care of.
And regarding the bath, you told you're talking about warm bath, warm water. അപ്പോൾ ഇപ്പൊ തണുത്ത വെള്ളം വെച്ച് കുളിക്കുമ്പോൾ then what happens? Will that produce that brown fat burning effect? അതുകൊണ്ടാണോ കുറച്ചുകൂടി ചൂടുള്ള വെള്ളം ഉപയോഗിക്കാൻ?
Muscle relaxation happens with warm water than cold water. Cold water വരുമ്പോൾ നമ്മളിങ്ങനെ ആവുന്ന കാരണം ആ മസിൽ റിലാക്സേഷൻ ചിലപ്പോൾ നടക്കുന്നില്ലായിരിക്കും. സോ
രാവിലെ തന്നെ തണുത്ത വെള്ളം മുതുകത്ത് ഒഴിക്കുമ്പോൾ പെട്ടെന്ന് നമുക്ക് full energy feel ചെയ്യാറുണ്ട്. So maybe that affects the sleep as well. Yeah. Okay. Hope is the best time for sleep from 10 p.m. to 6 a.m. I think so. Yeah, അതാണ് best time നമുക്ക് അവൈലബിൾ ആയിട്ട് ഉറങ്ങാൻ കിട്ടുന്ന സമയം തന്നെയാണ്.
That will be a total of 8 hours. So that's a good time. 10 a.m. to possible 10 p.m. to 6 a.m. But most of the time it's not possible.
I think we have covered almost most of the doubts shared by our audience.
എനിക്കൊരു ചോദ്യം ചോദിക്കാനുണ്ടായിരുന്നു. ഞാൻ ഇത് ഉപയോഗിക്കുന്ന ആളാണ്.
CPAP.
CPAP. ഇതാണ് CPAP മെഷീൻ. ഇത്രയുള്ള ഒരു മെഷീനാണ്. അതൊരു കംപ്രസർ പോലെ
അതിനെന്ത് വില? ഇത് ഇൻഷുറൻസ് കിട്ടിയത്?
ഇത് ഇവിടെ NHS-ലായതുകൊണ്ട് ഫ്രീ ആയിട്ട് കിട്ടുന്നതാണ്. അതാണ്. അപ്പോ ഇത് ഇപ്പോ ഡോക്ടർ ജോയ് പറഞ്ഞല്ലോ വേറെ പുതിയ മരുന്നുകൾ അവൈലബിൾ ആണെന്ന്. ഞാനത് ട്രൈ ചെയ്യണോ എന്നുള്ളതിനെ കുറിച്ച് ട്രൈ ചെയ്യുന്നത് നന്നായിരിക്കും.
Yeah, I always wondered how people sleep with one thing on the face. So when I ask the patients, they say they tell us that you should have prescribed us this some 10 or 20 years back, because they're finding it so comfortable after using this. But I don't have sleep apnea, so I was always wondering how people cover their face, and but people who have obstructive sleep apnea is one of the best. But there are drugs which are coming, which I think will slowly the BiPAP will go out with medications, I think.
Okay. Yeah. Thank you.
Okay. Thank you, Dr. Joy. It was a wonderful session. You covered, both scholarly and, normal സംശയങ്ങളും you have covered it. Only thing, perhaps it was in English. A few of our audience joined. They thought there would be Malayalam as well. But anyway, it was on a short notice. You took the responsibility of coming and presenting this wonderful session here. So thank you once again for you and to all the audience who participated in the today's session. Thank you very much.
Thank you.
Suaj,